Welcome to our Bonita's Maternity Program antenatal class. Today we're speaking with Sister Talia about vaginal infections in pregnancy. Welcome, Sister Talia.
Hi, moms. Yes, when we are pregnant, we are more susceptible to vaginal infection due to the fact that our immune system changes when we are pregnant. There's increased production of glycogen and higher estrogen levels. What does that mean? According to Albedazes in 2014 et al., he says that vaginal infections among pregnant women can cause serious problems because they lead to serious medical complications such as preterm labor, amniotic fluid infection, and premature rupture of membranes. However, proper identification and treatment will reduce the risk of preterm birth and its consequences. And that's why I'm bringing this important subject today. Types of infections. So believe it or not, there's 4 types of infections noted, and symptoms of these will be discussed by your midwife or gynecologist so treatment can commence. But this is some things to look out for. So vaginal yeast infection, this is probably the most common. I think most women pregnant or not has had it. So what is my symptoms? Itchiness around the vagina and vulva, a thick white cottage-like cheese vaginal liquid or discharge, odor. So the odor will be a bread or a beer. So it's a typical yeast smell, and pain or burning around the vagina. So what's the treatment? Pregnant women should go to their doctor or midwife to be diagnosed and placed on safe medication during pregnancy. Usually a vaginal cream will be prescribed or antifungal treatment. What can I do to prevent it? First of all, diet. So yeast, as you know, it's sugar and all things nice. So please try and cut down on the sugar fizzy drinks, cakes. All these increase the chances of a yeast infection. Also, taking a daily probiotic or yogurt can relieve it and treat recurrent infection. It assists in balancing the natural pH balance of the vagina, and it also promotes good bacteria. And one of the things you always hear is drink plenty of water, and it's no more true than for a yeast infection. It really helps to balance your pH. And underwear, this is a factor that I think we do take for granted. So in heat like we have now, there's thrush that grows because what does it need? It needs heat, it needs moisture, and it needs a breeding ground, and that is what we're giving it now with this heat. So please wear cotton, moms. It is really breathable, and it helps to just prevent and reduce the infection as well. Do not wear tight pants, ties, or clothes that for long intervals will have no breathing or kind of an airy thing is much better to wear, because all these things are breathing ground for infection. So the second one we come to is bacterial vaginosis. This is a bacterial infection in the vagina. It occurs due to an overgrowth of bacteria that normally lives in the vagina. If it's left untreated, it can have causes of premature labor or preterm births as well. So what is my symptoms? Itching is number 1. It's itching and burning around the vagina and the vulva. This one has a different odor. So remember with the previous one, the yeast, it had a beer-like, bread-like smell. This one has a fishy odor. So you'll notice something is quite off with this odor. It has a large amount of thin gray colored discharge, and it also makes urination painful. This is very simple to diagnose. Doctor will take a vaginal culture, so he'll swab you a bit. It's painless and quick in the doctor's office, and he'll usually treat you with a course of antibiotics. So the next one you may have heard in your pregnancy, it depends what stage of pregnancy, towards 35 to 37 weeks, doctor will mention something like, ma'am, you should go for a group B strep or GBS infection swab. And we do this, why? We swab you at around that stage in your doctor's rooms, and we usually send it away If we do test it as positive, we'll be commenced on a course of antibiotics just before delivery so that we make sure that it doesn't pass the infection to baby. Unfortunately, this is one of those things we cannot prevent and we won't know we have it. It's one of the things that's symptomless. It causes no effect to you. It could have been contracted various ways. Even bathrooms can have it, bathtubs, you know. It could have been years dormant in your partner. He doesn't either know he has it. So it's not a sexually transmitted disease. It is actually just something we have to treat because baby is the only person that can be influenced during birth, can have some complications with breathing, lungs, and pneumonias and things in baby. That's why we do treat it with some IV antibiotic, usually just before birth or during the birthing process. So this is quite a tricky one. This is trichomoniasis. And this is a sexually transmitted disease and infection. It is one of the most treatable STDs requiring certain antibiotics. However, prevention is key. You and your partner must be treated so you do not pass it back and forth to each other. Stick to one sexual partner and use condoms if in this case of this STD. What I always tell moms is why both partners needs to be tested. And I know it's quite a sensitive subject and it's something that moms are very embarrassed about, but now we treat you as the mom and we're treating you with all this great antibiotics and it goes away and you are no longer in danger. However, you and your husband or your partner have sex again and it just gets passed back again. So that is when it becomes dangerous. The same story applies. Why are we scared of this? It can have quite bad effects on your pregnancy. It can cause premature labor. It can have defects of sorts. So we do want to treat it. So how do I know I have this and not one of the other infections? So there will be itching, burning, and irritation during sexual intercourse. There will be a different type of discharge. Remember, the one had a thickish cottage cheese, that's his. The second one had a more grayish thin liquid. This one has a evident greenish yellow foul smelling discharge. So that is how we will monitor as midwives. And really, mom, we are not embarrassed about things like this. If you are noticing this, come in, we swab, and we do actually then do the next steps, which is medication. So just a disclaimer, this is not a diagnostic tool. This is simply a guide in identifying possible infections and should be discussed and managed by your doctor or midwife. Just some references in there as well. It's quite an interesting article. It's Vaginal Infections among pregnant women.